Earlier this year, around January 5th, I was crossing the road going to the store and a car hit me. People thought I was dead because I woke up in the hospital. I've been here since May 1st, May 2nd. Before that, I was homeless. I lived in a tent for 15 years at various spots across Austin.
Mr. Pevey unfortunately got hit by that vehicle. It caused a lot of trauma. He ended up at Del Seaton Hospital.
After that, I stayed in the hospital for about 3 or 4 weeks, and they moved me to a rehab. Nice rehab, real nice people. And learned how to walk again. I was in a wheelchair for about a month.
After the post-acute program, when folks have reached their rehabilitation potential, historically they have to discharge back to their previous living situation, which can be anything from living with family to being back on the streets. But fortunately for him, we had just started our medical respite program. Mr. Pevey was the very first person in that program, and medical respite is essentially a bridge between a rehab facility and being homeless. And so the goal is to provide a safe environment for someone to continue their rehabilitation in a safe environment where they can care for themselves and have adequate access to food and access to their medications and services that they need. And the respite program, he came across Dustin, one of our social workers who runs that program, and the pieces really just came together for him. He was able to do the virtual tour for Community First Village, and once the Social Security check came through, he was out the door and here in the unit that we're sitting in front of right now.
The biggest difference between living in a tent and living here is everything.
And that is really because he was connected with Central Health MAP, and we were really happy to facilitate his journey here.
I got a purpose now.